You're presenting here a study about something which is affecting resistance to endocrine therapy. Can you tell me what it is you were trying to look at when you configured this study?
Yeah, we know that 16-27% of patients with breast cancer express an amplification of a gene. This gene is a fibroblast growth factor receptor 1. We saw that patients that express this kind of gene, they are resistant to endocrine therapy. We don't know why, exactly why, and we are looking to try an explanation.
And you've got a preclinical study initially. What did you do in the study?
We found in patients treated with anastrozole endocrine therapy an increase of nuclear FGFR1 expression. We know the nuclear FGFR1 from 1984. It's a long time, but never is be associated with endocrine resistance. We see an increase after the treatment with endocrine therapy, and we try to understand why there is this increase.
Can you explain a little bit more about what this nuclear FGFR1 is?
Yeah, nuclear FGFR1 is the receptor. The FGFR1 could be found on the membrane, in the cytosol, but interesting, it's possible to find this receptor in the nucleus too. This is strange. Why there is this receptor in the nucleus? There is some paper, recent paper, that show that this receptor can bind the DNA and transcribe some gene implicated in the resistance to the cancer. And we found that this receptor can bind the estrogen receptor too and drive this resistance.
So did you suspect that it might be associated with resistance to endocrine therapy?
Yeah, we suspect this function of nuclear FGFR1 is really important to drive the endocrine resistance.
And what, in fact, did you find in the study?
We found that the FGFR1, the treatment with the letrozole with endocrine therapy, increased the nuclear expression of the receptor and increased the binding with the estrogen receptor, increased the interaction between the two receptors. And this interaction could drive the expression on some genes that are related with the resistance, with the cancer resistance.
This is in preclinical studies. What do you think would happen in a clinical situation?
Really, we found this interaction in tumor samples too, in patients treated with anastrozole, and we found the same in cell line. We started with the patients and we go to the bench.
What then do you think could be the clinical message coming out of this for cancer doctors?
Because I think the most important clinical message is the patients with estrogen positive, receptor positive, and with FGFR1 amplification should be treated with an FGFR inhibitor plus endocrine therapy.
And are there FGFR inhibitors available to do the job? Can you consider targeting this molecule?
Yeah, there are two studies ongoing. They use FGFR1 inhibitor, one without endocrine therapy and one in combination with endocrine therapy in USA and Europe.
But you've established it definitely has a role. So what would you summarize as the bottom line message for doctors coming out of all of this?
Check the amplification of FGFR1 before start the treatment with endocrine therapy. And if there is amplification, we have to consider to put these patients in a clinical study.